Hi, Dr. Jaclyn Rabito here, and from Let's Move Physical Therapy, and I'll be going more in depth on what you can expect from a pelvic floor evaluation. Just like any physical therapy evaluation, you'll come in, you'll either have your forms filled out before, or you'll fill them out when you get here. Same thing, if you have insurance, you'll pay your copay. If you're doing cash pay, then you'll pay cash. And then we'll start getting on into the questions. And so very similar to a regular evaluation, but just wanted to go a little bit more specific into it so that people feel comfortable. Here we have the 2 rooms. So one of the rooms, the door can be shut if you prefer when we start talking, or you can wait until we do more of the exam to have the door shut. We'll have sheets for everybody, so if they want to stay covered up, they can. You're not going to be hanging out the whole time because we got to ask other questions first and look at other muscles before that we get into it. And so usually you just start, you fill out your forms, we do our patient interview, be asking a lot of questions in regards to leakage, what you're eating, what you're drinking, any pain. Is it when you're sitting to stand, on and off the toilet, in and out of the car? So just things like that. So that could be something to be thinking about, like when am I having the most pain, or when is there the most leakage? How many pads do I have to go through? Do I leave the house? Do I not leave the house because I'm comfortable or not comfortable with what's going on? And then oftentimes what we'll do, so we'll get through all of that. I might test some of the muscles of the hips, the knees, your lower back. I'll look at that, especially your lower abs. All of that you'll do fully clothed, just like you would in a regular evaluation. And then we'll move forward to more specifics if you're comfortable with it, with moving towards the internal exam. And again, you'll have the sheet and everything, I'll have gloves on, and we'll go from there. And I'll be just looking just to see how everything looks down there, just as I would at any other joint. And so to me, the pelvic floor is a muscle. It's no different than anywhere else. So if it does cause you stress, anxiety, or starts to trigger things, tell me and we stop, and we just stop there. And a lot of times when I'm doing these evaluations, you're gonna hear me talking out loud, step by step with what I'm doing. Oh, I'm touching here, is that okay? Touching here, is that okay? May I proceed onward? Do you need me to stop? I'll be asking that, and it'll be a very back and forth on, communicating between you and I of if you're comfortable with things, not comfortable with things, or oh, that actually does cause me pain. Oh, that actually doesn't cause me any pain when you're touching there. Or oh, I have numbness, which can happen too, just like if you had a knee replacement or anything like that. Oh, I can't feel that when you're moving that around. And we'll go from there with that. And so too, you'll be hearing me talk about the clock, and I'll say, oh, this muscle should be at this o'clock, 2 o'clock, 3 o'clock, this is here at 6 o'clock, everything feeling okay. And it's more for me just to say it out loud and then to teach you the anatomy as we go. If you don't want me to do that, just tune me out, but it's good for me to say everything out loud so that I'm going through the steps and we're going through the steps together. And then I'll be asking you to bear down, squeeze, cough, laugh, and we're gonna see what happens there. If you have any leakage while you're here, please don't freak out. That's why we have the Chucks pads and everything to keep everything nice and clean. It's gonna happen and it's okay. And that's why we're here to really talk about it. And if you want to come in with a diary of when you're noticing things, great. If you want to wait till you get here and we talk about that further, awesome. You will be leaving here with homework. And it might be more to bring up your awareness or to work on specific tasks during the day. I'll also probably be giving a lot of people hip exercises. So you're like, oh, well, how come we're not only doing internal work and we're not only working on this? Well, we have to also address the hip muscles and your stomach, right? So your pelvic floor is the bottom, diaphragm is the top, abs are the front, and your back muscles are the back. And so that kind of keeps everything nice and enclosed in. And if one of those areas is lacking, we have to address it. So it might be more your lower abs, could be some of the back muscles, could be your breathing pattern is off. So we're going to be talking about a lot of different things because it all plays together with the pelvic floor. It's not just, oh, we're only going to address this. We're going to address the whole you and the whole piece so that you can work most optimally. And I know that throws some people for a loop, like, oh, well, we're only supposed to be doing this. How come we're working on breathing? Well, they go together hand in hand. So when we're going through to the evaluation, I'm asking you all those types of things, or asking you to breathe certain ways, or can you expand more here when you're breathing? That's why, because it all goes together, and we will be looking at function. So how is it any pain when you sit to stand, or when you roll on and off the mat, or if you're jumping Any leakage with that? How's that going? So we're going to be having a lot of those conversations, and I'm really excited for people to bring their questions or, oh, my body does this. Is that normal, or is that how it should be working, is more how I like to phrase it. Is that the most optimal way that things should be going? And yes or no, and we'll see. And we'll see too a little bit how the timing of when you drink stuff or eat stuff, how that affects you as well. Because we want you to be able to be out there and be confident in the world and like, I'm going to go grocery shopping and I'm not going to leak everywhere and it's going to be fine. So that's the goal. Or I've had 10 babies and I'm not leaking. So how do I get to that? And there's a bunch of different tricks with that. And some people have a lot of C-sections. So that's like a whole other conversation too. Also, anyone with kids that are having difficulties with that, I don't do any internal exam on kids. However, that's a conversation we can have though, as far as like the timing of things and school, and let's bring this to your attention and that to your attention. Might do some more cranial sacral therapy work in that instance. But I do definitely still want to bring that conversation because I know toileting in the schools or as kids get older is a topic that needs to be addressed as well. When do we start to introduce diapers or pads and stuff like that? And so that's something I really want to discuss because remember, it's a muscle and we want to be sure that it's being used correctly. We might have a little visitor here. Oh, here she comes. So we definitely want to get that addressed and talked about too. And, you know, I'll be talking, like I said, out loud a lot, talking about the different layers of the muscles and which ones, oh, this one's, you know, firing real good. Let's work on this other one. And we'll do that type of a thing. And of course, along the way, if you have any questions, please ask your questions. I have, just so you're aware, my little mini sheets that you'll see me using. They've got different anatomy pictures on them, so don't freak out when you see those. I'm very excited to help this population, especially those with leakage, because that's just no fun. And nobody wants to have to worry about that all day. So please give us a call and we'll get that addressed. Or if you've already given me a call, this is kind of your introductory so that you can kind of prepare your mind for what you need. I do recommend that you wear kind of loose fitting pants so they go on and off faster because it's just easier. Or if you want to wear a skirt, come on down with that too. And this does apply for men as well, so they could just wear loose fitting pants too. And if you of course have any questions, please feel free to call, email, or text. Get your doctor referral if you're going through insurance. If you're going cash pay, come on down and let's get it started. Have a great day.